Well, because the private sector is important in addressing global health issues, because the private sector is affected in so many ways by global health issues. Everything from the healthcare costs, which are reaching a tipping point, to the productivity, the lost talent, the ability to stay competitive. All of these things make a difference in the private sector. And we found, for example, that corporations can cut their healthcare costs in half in the first year simply by making changes in making it easier for their employees to make healthier diet and lifestyle choices. Well, the lifestyle changes themselves really don't cost anything. They just need a pair of walking shoes, a yoga mat. The diet that's really the healthiest for people to eat actually is the lowest cost. You know, fruits, vegetables, whole grains, legumes, soy products, a little fish. It's basically a third world diet. What's happening is that it's diverting, as other countries are starting to eat like us, live like us, and all too often die like us. Heart disease and type 2 diabetes are killing more people in most parts of the world today than AIDS, tuberculosis, and malaria combined. And so it's diverting and siphoning off precious resources from treating things that really do require drugs, like AIDS, TB, and malaria, to things like heart disease, diabetes, early stage prostate cancer, and so on, that can be largely prevented and even reversed simply by changing diet and lifestyle at a fraction of the cost, and the only side effects are good ones. Each year for the last 10 years or more prescriptions have been written for antidepressants, more money has been spent treating depression than any other category of pharmacy drugs. And the reason is that there's so many depressed people out there. And it's not just being a little blue, but really depressed. I mean, when you're depressed, you know, you're seeing the world through dark glasses. You know, it's not just you feel bad today, but you'll feel better. They'll always be bad. The times you really thought that they wouldn't be, you were just fooling yourself. And so that's where that sense of helplessness and hopelessness comes from. So people who are lonely, depressed, studies are showing, are 3 to 10 times more likely to get sick and die prematurely than those who have a sense of feeling good, of love and connection and community. So it not only affects the quality of our lives, it actually affects our survival, both indirectly because you're more likely to smoke and overeat and drink too much and work too hard and abuse substances if you're depressed. That's how people cope with their pain and numb it and bypass it. But you're also, through mechanisms that we don't fully understand, much more likely to get sick and die prematurely. So treating depression is also not only important for our health, but also for a company's bottom line. It's very hard to be productive and creative when you're feeling depressed. And so by working, asking people, creating social networks, I find that social networks are a real antidote to depression, not just the superficial ones like you find on the internet, on Facebook and things like that, but real ones. And so to the degree that corporations can encourage their employees to talk with each other, to be together, to support each other, it's not only good for the company, it's good for the profits as well, because more than any other single intervention, that I think is a primary determinant of health and well-being. Well, traditionally, GBC has been a wonderful pioneer in bringing business together around AIDS and TB and malaria, and those are still big issues. But the rise of what are sometimes called non-communicable diseases, heart disease, diabetes, prostate cancer, breast cancer, and so on, obesity, are actually killing more people today than in most countries than AIDS, TB, and malaria combined. And so I'd like to see more of an emphasis put on not just AIDS, TB, and malaria, but also these chronic diseases, because they interrelate to the extent that they're diverting resources away. But also, when your immune system is better, you actually reduce your likelihood of developing these other conditions, these infectious diseases. It all interrelates in ways that are very powerful. And it's not that there's one diet and lifestyle program for heart disease and another one for prostate or breast cancer and a different one for diabetes. It's the same. These are healthy changes that make you strong, that can prevent and reverse these diseases, and thereby free up resources to treat things that really do require drugs like AIDS, TB, and malaria. And I'm glad that GBC invited me to speak this year, and I hope we can see more of that emphasis moving forward. You know, just to say again that, you know, reimbursement is such a powerful determinant of medical practice and even medical education. And now that Medicare is covering our program, I'm hoping that that will make a key difference as we move forward. And if there are businesses that are interested in learning more about our work, we're more than happy to work with them. We're doing it right, all of it now through our nonprofit institute. But there's so many opportunities to make a difference in the world, and we'd love to explore them with you.